Certainly, there is a little bit of upfront work, the biggest piece being something like the updated PIA or privacy impact assessment. That being said, I like to think of it as sort of, an initial investment of time and effort for a long-term return that will actually make things easier for the physician and their staff. And certainly also PCNs can provide support in terms of practice facilitators and other staff that can help to facilitate some of that work with your clinic's frontline staff. So I understand the concern. It is a good question to bring forward, but I think it is ultimately sort of short-term pain for long-term gain, and PCNs can help to kind of get over that hump a little bit and move forward with the work.
Actually, there really isn't very much physician work other than dealing with the e-notifications. If you're initiating CII CPAR, you might want to have a brief meeting with your physicians and your clinic staff, just so that everyone's on the same page and knows what CII CPAR is and isn't, and what information from your EMR is going to flow to Netcare. But after that, most of the work is done by the staff and not by the physicians. In terms of staff work, though, once you're signed up and you're going, you do get demographic mismatch reports, but only once a month. And after your first one, there usually isn't very many names on there. So this is where if there's a mismatch between the information coming from your system and Netcare, you'd get a report of that. So your deceased patients would be on that list. And certainly sometimes we've had surprises and found out that a patient is deceased that we didn't know about. So that's been great information to get. There's also panel conflict reports. So this is where a patient is on your confirmed panel list and someone, different physician who signed up for CII CPAR. But what you do with this information is up to you. At the moment, there's no financial penalty to having patients on two lists. So you might know about it already. You might have a patient that has a rural physician, but also sees you in Edmonton, or you might not know about it, and it might be a way to sort out with the patient who is providing their care. So I think it can be quite valuable information, and I think it's worth the limited amount of time that the staff needs to spend to look at these reports with you.